This pain doesn't come from an injury, doesn't show up on every scan. Doctor, it's not serious.
I'm Dr. Your Name, and today I'm going to show you why your back pain isn't just a pulled muscle. It's a complex web of strain, wear, and nerve pressure that can start from something as simple as sitting too long. This is low back pain, the #1 cause of disability worldwide. But here's the truth. You can heal it without surgery, opioids, or endless PT.
Let's break down the science and the real fix. Your lower back is a masterpiece of engineering, but when one part fails, the whole system breaks. Here are the 4 main culprits behind low back pain. One, muscle strain or ligament sprain, most common cause. Lifting wrong, twisting fast, or even coughing too hard can overstretch or tear muscles or ligaments. Inflammation kicks in, causing spasms, stiffness, and sharp pain. 2, degenerative disc disease. With age or overuse, spinal discs dry out and shrink, they lose their cushioning ability. This leads to chronic aching, especially after sitting or standing too long. 3, herniated, slipped disc. When the soft center of a disc pushes through, it can press a nerve root. That's when you get sharp, shooting pain down the leg. Sciatica. Numbness, tingling, or weakness can follow. 4, facet joint osteoarthritis. These tiny joints guide movement. When they wear down, they become inflamed, causing stiffness, especially in the morning. Stiffness that improves with movement is a hallmark.
Here's why people stay stuck. Pain isn't just tissue damage, it's movement dysfunction. Resting too long weakens muscles. Painkillers mask pain without fixing the cause. 90% of low back pain gets better, fast, with the right approach. Here's how to heal, prevent, and reclaim your back. #1, move early, move often. Bed rest for more than 2 days worsens recovery. Movement pumps nutrients into discs and reduces stiffness. #2, strengthen your core and glutes. Your spine is only as strong as its support system. Do these 3 X/week. Strong glutes take pressure off your lower back. #3, fix your posture, especially sitting. Use a lumbar roll or small pillow. Keep feet flat. #4, try the McKenzie method for sciatica. Lie on your stomach, prop up on elbows, hold 10 seconds, repeat 10 times. Stop if it worsens pain. #5, address the mind-body connection. Chronic pain is amplified by stress, fear, and tension. Breathe deeply. Calm your nervous system. Your brain can unlearn pain with the right tools. David, 44, couldn't pick up his toddler without pain. Doctors said, "It's degeneration. Live with it." He says, "I didn't need a miracle. I needed movement." If you've been told your back pain is normal, this is your sign to move, strengthen, and heal. Start today with a 10-minute walk. Share this video. Someone's back depends on it. Download your free low back pain recovery guide. Link in description.
I'm Dr. Your Name, and I'll see you in the next video, where we don't just survive back pain, we erase it with motion.